This video is going to be about en-bloc capsulectomy. So with breast implant illness, people are concerned about not only removing the implants, but also the body's capsule that is formed around any implant, any breast implant. That capsule is typically a thin layer of scar tissue that usually goes unnoticed. But with breast implant illness, because there's some concern that some of the products from the implant might be within the capsule, might be contributing to whatever is triggering the illness, that removing the capsule in its entirety is a critical maneuver. Now, again, there's not a lot of science or data to support this, although capsules that come out can be shown to have products or ingredients from the implants within them. For example, silica, which is sometimes used as a filler in breast implant manufacture. And it is known that silica can be somewhat immunogenic and trigger reactions from the body. So nevertheless, getting the capsule out is important to people. The name en-bloc capsulectomy, I think, is a bit of a unfortunate name, because en-bloc anything has implications in the field of cancer treatment and surgery. Okay, when an en-bloc procedure is done, it's a pretty radical procedure, removing some surrounding normal tissue to get the cancer out, the tumor out. So this name of en-bloc capsulectomy has been taken and used in the context of breast implant illness and capsule removal, but I think it's a bit unfortunate. Anyway, everyone knows what it is, and it probably won't change, but I kind of wish it was something different, like maybe a synchronous capsulectomy, meaning you're taking the implant and the capsule out in one piece at the same time, obviously. And that's kind of what's implied by the en-bloc capsulectomy, that the implant is coming out with the capsule in one piece. So a total capsulectomy is a name that can mean different things. So an en-bloc capsulectomy is a total capsulectomy, but a total capsulectomy is not necessarily an en-bloc. Okay, so if one was to take out the capsule in multiple pieces, but it all comes out, well, that's a total capsulectomy. The difference is it's in multiple pieces. And again, in breast implant illness surgery, we like to take it out in one piece if possible. So that's kind of the different. Partial capsulectomy is done sometimes with people with capsular contracture, mild capsular contractures, or part of the capsule being a problem with scar tissue, for example, but that's a completely different realm. All plastic surgeons are very well versed in capsulectomies for capsular contracture, which is when the scar capsule around an implant gets thick, hardened, calcified. It can contract, cause distortion and even pain. That's a recognized non-controversial thing, complication that can happen with implants. Okay. In breast implant illness, ironically, the capsule looks to the naked eye very normal, very thin, supple, not thickened, not calcified, not contracted. So most of the folks that I see for BII related to cosmetic implants, that's what I see. I don't see anything unusual, and people are often surprised. Surprised, and they ask me, "What did you see? Did it look abnormal? Did you see anything?" No, it looked normal. But that doesn't mean that there's not a systemic issue going on from the implants or what might be within the capsule. Okay, so an acute process such as an infection, whether it's fungal or bacteria, that's going to be pretty obvious. The patient's going to typically be sick. The breast is going to be painful and swollen. And when I get in there to remove that or drain that, yeah, that capsule is going to probably be thickened. There might be fluid within it. That fluid would be sent for cultures and fungal and the whole bit. The capsule might be sent for pathology. Again, that's rare. That's not common, and that's definitely not common with breast implant illness. Again, usually the capsule is very unremarkable to look at. I'll probably add to that in upcoming videos about the surgical techniques and some of the nuances of the procedure, but that's the basics of what an en bloc capsulectomy is.